Hi everyone, this is our pharmacology project on heart failure. The people in my group are Sabrina, Jenna, and Kaila. So what is heart failure? Heart failure is a disease where the heart does not pump enough blood to meet the body's requirements for blood and oxygen. It is chronic and progressively gets worse over time. To compensate for the lack of blood flow, the heart will hypertrophy and pump faster to try and meet the body's needs. What are the symptoms of heart failure? A person will first notice that they're feeling extra tired, and then they'll have some difficulty breathing. They also may experience chest pain, a cough, or dizziness. Some factors that contribute to heart failure include smoking, obesity, high-fat diets, high sodium intake, high cholesterol diets, and the lack of exercise. Heart failure is typically treated with medications, dietary changes, and daily exercise. Here are some statistics about heart failure. About 5.7 million adults in the U.S. have heart failure. In 2009, 1 in 9 deaths included heart failure as a contributing cause. About half of the people that develop heart failure will die within 5 years of being diagnosed. These are some of the classes of drugs that help treat heart failure. The first one is the ACE inhibitor. These increase cardiac output by lowering the blood pressure and decreasing the blood volume. An example of an ACE inhibitor is lisinopril. The angiotensin II receptor blockers, they increase cardiac output by lowering blood pressure and decreasing blood volume. Examples of these are valsartan and candesartan. The next is diuretics. Diuretics increase cardiac output by reducing the fluid volume and decreasing the blood pressure. An example of this is furosemide. The next is beta adrenergic blockers. These decrease cardiac workload by slowing the heart rate and decreasing blood pressure. An example of this is metoprolol extended release. The next are the direct vasodilators. These decrease cardiac workload by dilating vessels and reducing the preload. An example of this is hydralazine with isosorbide dinitrate. Cardiac glycosides increase cardiac output by increasing the force of myocardial contraction. An example of this is digoxin. And the final class of drugs is the phosphodiesterase inhibitors, and these increase the cardiac output by increasing the force of myocardial contraction. An example of this is milrinone.
Okay, as mentioned earlier, I'm just going to go into more detail of the different drug classes. The first one is ACE inhibitors, which lisinopril is an example of it. The dosages are 10 milligram a day, and max is 40 milligrams a day per oral. Some adverse effects, the ones that are italicized are common adverse effects, and the ones that are underlined are the serious adverse effects, and it includes headache, dizziness, orthostatic hypotension, cough. The serious adverse effects are severe hypotension, syncope, angioedema, and blood dyscrasias. There are some interactions. Drug-to-drug interaction is indomethacin and other NSAIDs. Lab tests may cause positive ANA titers, and increased values of blood urea nitrogen, the serum bilirubin, and serum alkaline phosphate, AST, and ALT levels. Herbal and food interactions are excessive intake of foods rich in potassium and potassium-based salt substitutes. Our next drug is valsartan, which is an angiotensin II receptor blocker. For the dosages on this is 40 milligrams twice a day, and max is 320 milligrams a day per oral. The interactions for herbal and food includes ginseng, licorice, and ephedra. Drug-to-drug interaction includes alpha blockers, alpha agonists, amphetamines, ACE inhibitors, other ARBs, barbiturates, beta-adrenergic blockers, calcium channel blockers, diuretics, heparin, and low molecular weight heparin, monoamine oxidase inhibitors, nitrates, NSAIDs, and phosphodiesterase 5 inhibitors. The common adverse effects include headache, dizziness, orthostatic hypotension, rash, and diarrhea. The serious adverse effects include angioedema, acute renal failure, first dose phenomenon, fetal toxicity, and neonatal mortality. Next, furosemide is an example of diuretics. So the common adverse effects for this drug is electrolyte imbalances, orthostatic hypotension, and serious adverse effects include severe hypotension, dehydration, hypokalemia, hyponatremia, and ototoxicity. Drug-to-drug interactions are cardiac glycosides, digoxin, corticosteroids, amphotericin B, potassium-depleting drugs, and lithium. Lab test interactions, it could increase values for blood glucose, blood urea nitrogen levels, serum amylase, cholesterol, triglycerides, and serum electrolytes. And herbal and food interactions are hawthorn, ginseng, and high sodium intake. Next, we have metoprolol extended release, which is an example of the beta-adrenergic blockers. Some common adverse effects for this are fatigue, insomnia, drowsiness, impotence or decreased libido, bradycardia, and confusion. Serious adverse effects are agranulocytosis, laryngospasm, Stevens-Johnson syndrome, anaphylaxis. And I mentioned on there, if the drug is abruptly withdrawn, the patient can have palpitations, rebound hypertension, life-threatening dysrhythmias, or myocardial ischemia. Some drug-to-drug interactions with this is digoxin, oral contraceptives, alcohol, antihypertensives, and insulin. And for lab test interactions, we could have increased values in uric acid, lipids, potassium, bilirubin, alkaline phosphatase, creatinine, and anti-nuclear antibodies. Next, we have hydralazine with isoboride dinitrate, which is a direct vasodilator. Common adverse effects are headache, flushing of face, orthostatic hypotension, dizziness, and reflex tachycardia. The serious adverse effects are fainting, severe headache, severe hypotension with overdose, and lupus-like reaction. Some drug-to-drug interactions are antihypertensives and NSAIDs. Lab tests interactions, it could produce a false positive Coombs test. And herbal and food interactions is hawthorn. Next, we have digoxin, which is a cardiac glycoside. Common adverse effects are nausea, vomiting, headache, and visual disturbances such as seeing halos, a yellow-green tinge, or blurring, and then serious adverse effects are dysrhythmias and atrioventricular block. Some drug-to-drug interactions are diuretics, ACE inhibitors, potassium-sparing diuretics, beta blockers, antacids, cholesterol-lowering drugs, calcium, quinidine, verapamil, amiodarone, and alprazolam. Some herbal food interactions are ginseng, mahuang, and ephedra. Lastly, milrinone, which is a phosphodiesterase inhibitor. Some common adverse effects are headache and hypotension, and then serious adverse effects are dysrhythmias. And drug-to-drug interaction for this is digoxin, dobutamine, and disopyramide.
All right, now I'm going to talk about lisinopril and the importance of patient teaching. Lisinopril is the most frequently prescribed for both hypertension and heart failure, and it has been approved since the 1980s. It is used to slow the progression of the disease by reducing both blood pressure and cardiac output. It's important to inform the patient that it may take 2 to 3 weeks for the medication to reach its maximum effectiveness, and it may take months for their cardiac function to return to normal. A few adverse effects that the patient should be taught include cough, headache, dizziness, and rash. More severe that the patient should be aware of is orthostatic hypertension. Since lisinopril is both a medication used for heart failure and hypertension, it does affect the blood pressure, so the patient should be advised to stand slowly and be careful with positional changes. It may also cause hyperkalemia, so the patient should be advised that excessive intake of food rich in potassium and potassium-based salt substitutes should be avoided due to the possibility of hyperkalemia. Lisinopril is also a pregnancy category C in the first trimester and pregnancy category D in the second and third, and it may cause fetal injury and death, so it should be discontinued immediately if pregnancy is suspected. The patient should be instructed to stop the drug immediately and report signs and symptoms suggesting angioedema, such as swelling of the face, eyes, lips, or tongue, or any difficulty swallowing or breathing. The patient should be cautioned to report lightheadedness, especially during the first few days of therapy, and if syncope occurs, to discontinue the drug and notify the provider. The patient should be aware of fluid losses, such as excessive perspiration, dehydration, vomiting, or diarrhea. The patient should be advised to immediately report signs and symptoms of fluid and electrolyte imbalances. These signs and symptoms include, but are not limited to, dry mouth, thirst, weakness, lethargy, possible seizures, and muscle pains. The patient should be informed to promptly report signs and symptoms of infection, such as fever and sore throat. And the patient should also be warned that lisinopril may cause a dry, non-productive, annoying cough. It's important to teach the patient, the family, or the caregiver to take a peripheral pulse prior to taking the medication and report daily pulses. Instruct the patient on the need to return for lab work, especially assessing potassium levels. It's important to note daily weights and report a weight loss or gain of more than 2 pounds within a 24-hour period. And it's important to notify the patient to always take the precise dose of medication prescribed and not to double the dose if a dose is missed. Taking the medications as directed is the best opportunity to benefit from heart failure treatment.
That concludes our presentation on heart failure. Here are our references, and we hope you enjoyed.